The following podcast has been designed to assist with your understanding of collective training in a COVID-19 environment. The current COVID-19 pandemic has created a new, challenging and unknown environment that is a direct biological threat to our force and is an enduring condition that impacts all of our training. We must ensure that our activities mitigate against the spread of COVID-19 and that we do not risk spreading the infection to the wider UK population. Therefore, we must continue to adapt to this threat and the enduring condition. Our activities must protect the force through distancing and isolation practices to ensure soldiers remain healthy and ready to deploy. This includes the use of protective equipment where necessary, screening and testing of the force, and enforcement of standards by commanders. Collective training will require leaders and formations to perform tasks in close proximity to one another, which creates risk of transmission of COVID-19 to the force and the people intimately related to our business, such as families, contractors, and enabling staff. The aim of this podcast is to support your understanding of how we all need to operate within a COVID-19 environment. This podcast should not be watched in isolation, and the collective training group standing operating instructions should be read in full, and this podcast used to augment understanding. The standard operating instructions provides guidance and direction to planners in order to assist with the execution of training while mitigating risk to the force. We must also bear in mind that our actions can only mitigate against the spread of COVID-19 and not eliminate the threat completely. Not all COVID carriers will show symptoms, therefore it must be emphasised to remain vigilant to an unseen and constant threat. We must maintain the highest professional standards and follow the guidelines, or we risk spreading a wider infection. COVID mitigation must become business as usual. Personal protective equipment or testing cannot be relied on as a catch-all approach to eliminating the risk of COVID-19 outbreak, and social distancing should be applied and must be applied wherever feasible. And this is the best single practice to protect personnel from contracting the virus. This image has been taken directly from the standing operating instruction and is a visual representation of how to operate within a COVID environment. The diagram assists with understanding the whole process and its component parts. 4 layers have been created to assist with identifying the conditions throughout the environment. Prior to commencing any collective training, units must prepare well. Self-isolation of all personnel for 14 days prior to commencement of training will reduce the risk of COVID-19 infection for the training audience and enabling staff. Unit preparation should consist of identifying any vulnerable personnel. Units may hold service personnel who have chronic conditions or diseases that could present additional risk factors and endanger life if they were to contract COVID-19. Service personnel may also have vulnerable family members that require shielding. You should endeavour to identify these personnel and remove them from the training orbit at this point. Army guidance on environmental health assessments for COVID-19 is available on request. You must ensure that a force health protection brief specific to your activity is developed and distributed prior to your activity. We then begin training by entering Layer 1, and this consists of unit concentration. A dispersed population concentrates at a designated unit location to begin the first filter and access Layer 1. The unit should screen its personnel for any symptoms of COVID-19. This can be done via a questionnaire, temperature testing, or another form of testing if it is available can be used. Personnel who show signs and symptoms of COVID-19 are returned home to self-isolate immediately. If they are free from symptoms after 14 days, they may return to training. Before moving to the training location, the unit is to complete a Fit to Attend certificate. An example of this is contained in the standard operating instruction. Particular attention should be made to the transport plan and ensuring no cross-contamination amongst the training audience or support staff during unit moves to and from the training location. The red box is to emphasise that we need to apply leadership rigour and vigilance. An early observation that has been identified is to not assume that all personnel are conducting themselves appropriately or understand the mitigation measures. Therefore, continuously check that COVID-19 mitigation measures are being applied and are understood by all. Layer 2 sees you enter the reception point. The unit moves to the training location and is received by the training authority at a pre-designated reception point. Here, all personnel are screened by the training authority once more for signs and symptoms of COVID-19. Personnel showing signs and symptoms could be RTU'd, isolated at unit lines, or held in an isolation zone within the training location for 7 days. Entry to Layer 2 is completed when the whole force, the training audience, training authority, contractors and support staff have been received at the training location and grouped into their pre-agreed households ready to train. Householding. Initial planning of training for any unit requires deliberate concentration of the size of the unit conducting training and how the unit intends to separate groups into the smallest possible size. Identified households must be able to maintain advised distancing measures and be clearly identifiable at all times. There should be no mixing whatsoever of personnel between households. We then establish Layer 3 and working in the control zone. Layer 3 provides access to the control zone. It is here that conduct of collective training takes place. Access and activity is rigorously controlled to minimise vectors for cross-contamination of households and to balance the training requirement against the protection requirement. Each day should begin with a go, no-go dynamic risk assessment at XCON, considering the health of all households, the availability of equipment and material to protect the force and the level of activity to be conducted. Monitor. Identify possible COVID-19 cases. This could be via self-reporting, medical intervention, screening or test results. Isolate. Remove individuals exhibiting positive symptoms or who have tested positive from households. Commanders may need to consider working in isolation to progress training if this is deemed necessary. Trace. Initiate tracing of close contacts. Quarantine traced personnel as a cohort. Units should consider working isolation for those who have been exposed to possible COVID-19 symptoms but may be asymptomatic. Test. Seek to test and confirm or deny whether COVID-19 is present in individuals. This could be via national testing centres involving a planned move to an identified centre or via other methods as they become available. If asymptomatic testing is available, personnel identified through tracing are to be tested. Depending on accuracy and availability of testing, units are to consider retesting requirements. Following 2 negative recovery tests, return recovered individuals to training. The Chain of Command will assess individual and collective requirements to progress through the training pipeline. Clean. Sanitize equipment, vehicles, accommodation areas and facilities used by the individuals that were tested positive. Return. Ensure that quarantined individuals remain under supervision and are regularly checked to identify early signs of severe symptoms. Be prepared to evacuate individuals who are showing signs of severe symptoms. Once training is completed, you will enter Layer 4 and exit the training and be ready for operations. On completion of the activity, the unit will disperse. Exit procedures from the control zone into Layer 4 will depend on PJHQ or divisional pre-operational requirements. Time until deployment and additional moves required will also be a factor. A final screening will be conducted by ExCon, which will subsequently advise on any individual measures to be taken. There is more detail in the standing operating instruction. So if you require any further clarification on operating within a COVID-19 environment, then please do not hesitate to contact a member of CTG.